Welcome to Imprint Within. This channel's focus is on health, wellness, healing, and wisdom for information and guidance so that the best decisions for your well-being can be made. I'm your host, Linda Kay. Welcome to those of you who are new to this channel, along with those of you who subscribe. For those of you who are new, I am a licensed healthcare provider that specializes in massage therapy, energy therapy, injury rehabilitation, and skincare. This is a Take 5 Did You Know segment, which is for information and entertainment purposes only, and any suggestions made should be researched further so that you can make the best decision for your well-being on this earthly plane. If you enjoy this information, please be sure to like, subscribe, and hit the bell for notifications of future segments so that YouTube will keep the algorithm strong and that more viewers will have an opportunity to see the Imprint Within videos in our pursuit to assist others. Today on Take 5 Did You Know? I'm going to answer a question from Arigato7 regarding having an injury and receiving massage therapy as a treatment. Arigato7's question reads, I recently had a fall and ended up with extreme back pain. My doctor prescribed physical therapy, but all my friends are telling me to get a massage. Which treatment is more beneficial? Thank you, Arigato7, for the question. Although this particular question is fairly vague, with little pertinent information regarding your actual injury, let's look at the benefits of massage first, and then address some possible scenarios regarding your mentioned injury. Regardless whether you are injured or not, receiving massage therapy on a regular basis, which is at least once a month, is greatly beneficial to the human body. On WebMD, Dr. Jay Winner, author of Take the Stress Out of Your Life and director of the Stress Management Program for Sansum Clinic in Santa Barbara, California, says, stress doesn't only make us feel awful emotionally, it can also exacerbate just about any health condition you can think of. Experts estimate that upwards of 90% of disease is stress-related, and perhaps nothing ages us faster, both internally and externally, than high stress. Massage therapy is an effective tool for managing this stress, and it does it by decreasing anxiety, enhancing sleep quality, stimulating greater energy flow, improving thoughts and concentration levels, increasing circulation, reducing fatigue, and relaxing the nervous system. So let's look at how a massage therapy session induces these conditions. During a session, your physical body will begin to relax, which allows your central nervous system to regulate in a more efficient manner. Your massage therapist will discover pockets of tension or constriction in your muscle tissue and will try to release it. They will push new blood into the tissue so the old stagnant blood can dissipate, allowing the tissue to receive much needed nutrition from the newly entering blood supply. In the end, most of the above conditions will improve and you will feel refreshed and renewed. Now, massage therapy can also help address a number of health issues that you may be having, such as alleviating lower back pain and improving range of motion, enhancing immunity by stimulating the lymph flow, which is your body's natural defense system against unwanted disease, providing exercise and stretching to weak, tight, or atrophied muscles, increasing joint flexibility, promoting tissue regeneration, reducing scar tissue and stretch marks, pumping oxygen and nutrients into tissues and vital organs, which in turn improves circulation, reducing spasms and cramping, as well as post-surgery adhesions and swelling, relaxing and softening injured, tired, and overused muscles, helping athletes of any level prepare for and recover from strenuous workouts, as well as many other health issues. So massage therapy on the whole is extremely beneficial to the human body. Now let's look at the circumstances involving a body injury. When the body receives an injury, either through an abrasive action or possibly a surgical procedure, the body goes into a traumatic state of confusion. The tissues in the body literally think you are trying to hurt it, and so it will constrict in order to protect themselves from your actions. Depending on the extensiveness of the injury, the body already has decided it no longer trusts you, and sometimes it can take a long time for the body to trust you again. That is where therapy comes to play. Usually, with a severe injury or a major surgery, your physician will prescribe physical therapy so your traumatized body can be rebuilt against through stretches and exercise protocols. Some physical therapy programs believe they have to break you down to build you up. But for most people over 50 who are already broken from all their life experiences, this type of therapy program usually doesn't work. People over 50 usually need a program that allows the muscle tissue to work and release at its pace, not at the pace of the physical therapist. This is where the massage therapy comes into play. There are many physical therapy programs that include massage therapy as part of their protocol, but not all programs do. When a massage therapist comes into play, their therapy protocol is going to include the injury and how it affects the entire body unit. They will look at the degree of trauma that has inflicted on the whole body and will work with the muscles that have been injured at the pace the affected muscles will accept the treatment. For example, one of my specialties is as an injury rehabilitation massage therapist. And when I am working with a client, I want to know how the injury occurred, how the client feels about the injury, and to what degree is the client's current range of motion and flexibility, or the lack of, not allowing the client to live a balanced lifestyle. The physical injury itself is only one part of the process. There are always emotional symptoms attached to the injury that will either allow the injury to heal or counteract against its recovery. This information is usually obtained through the consultation session between the client and the massage therapist. Next, I'm going to get the client on the table, and if that is not possible, in a comfortable chair or in a standing position. Sessions can run from 15 to 30 to 60 minutes. And sometimes injuries will not allow a client to comfortably lie on a table for a long period of time. So as a massage therapist, I need to make adjustments where needed. When I have the client in a comfortable position, the first thing I'm going to do is relax their nervous system. All diseases and injuries are ruled by the nervous system. If the electrical energy emitted from the nervous system is not getting to the injury in a proper flow, then that means the neurons are misfiring, creating electrical chaos throughout the body. This is why the client feels a pain pattern. By relaxing the nervous system first, when it is time for me to start working on the constricted tissue, that tissue will conform and allow the client the ability to handle any treatment techniques I may use. Now, depending on the intensity attached to the injury, this process may be quick or not. And sometimes it may take a few sessions just to relax the nervous system from the trauma it has endured. Now, because I am also a body energy therapist, I will relax the client's body by using such energy techniques as craniosacral therapy, polarity therapy, Jin Shin, or Reiki, just to name a few. I find the most effective technique to get the client relaxed in the very beginning of the session is by using the 3 vault holds from the craniosacral therapy. These holds are performed at the head and allow the dura mater that encapsulates the spinal cord to start pumping in a regular rhythm. Once the body is relaxed, I can start to focus on the injury or the constricted tissue. Now, please note that to a layperson, injury rehabilitation massage is not a relaxation massage. It is a massage that focuses on the constricted tissue associated with the injury, and the massage therapist can be working in a small area for the entire length of the session if necessary. As a massage therapist, this type of massage is extremely tedious and can at times be painful for the client. Monitoring and communicating with the client at all times is necessary. So that gives you a little background information regarding massage in general and massage therapy for injuries. Now, to answer Arigato 7's specific question, which treatment is beneficial? The answer is both. Physical therapy and massage therapy is beneficial, especially in an injury scenario. But I am going to suggest that after Arigato 7's physical therapy sessions are complete, do continue with massage therapy so the pain pattern created by the injury does not reoccur by some other action your body has performed. Once again, I would like to thank Arigato 7 for submitting their injury healing related question. If you have any questions that are related to health, wellness, healing, and wisdom, submissions are accepted through email only at imprintwithin@gmail.com. That's imprintwithin@gmail.com. Please be aware of imposters, possibly trying to get your attention either through a variation of the Imprint Within name or our email address. You will not be contacted by Imprint Within through any YouTube platform, only through the imprintwithin@gmail.com email address. Imprint Within is about awakening and using the natural healing force within your body to assist in keeping you healthy. And to do that, you take that natural healing action a step further by understanding that healing comes from within and that you are a major part of your own healing process with self-healing at work 24/7. Again, I appreciate you being here and thank you for actively watching the various videos that have been produced. Be sure to like, subscribe, and get notifications by hitting the bell on your viewing device. And always remember to be kind. I'm Linda Kay. Thanks for being a part of Imprint Within. Until next time.